Hi there, everyone. Dr. Andrea Schnowske from Freedom Chiropractic and Holistic Health. And I'm really excited tonight because one of the things that I get a lot of questions about is how is holistic health going to help me with cardiovascular risk and my cholesterol numbers? So tonight is all about talking what your doctor's not telling you when it comes to your cholesterol level. So some of you that have high cholesterol levels may not know that you can manage that a lot of times with diet and exercise and not need to be on a lifelong medication. So tonight we're going to talk a little bit more about what your doctor's not telling you about cholesterol. We're going to talk a little bit more about what you yourself can do to get your cholesterol level under control. We're going to talk about some dietary changes. We're going to talk about some exercises and things that you can be doing naturally to get that level back in range. And we'll talk a little bit more about what we do in our office that can help to get those cholesterol levels under control. So we're going to go ahead and get started. I'm going to go ahead and share my screen so you can kind of see everything here. And we will go ahead and get started. Okay, let's see if you can see everything here. It's doing weird stuff. Hold on. There we go. All right. So really, like I said, the biggest thing that I want to kind of talk to you tonight about is really what your doctor's not telling you about cholesterol and things you can be doing yourself to get that level under control. So for those of you that don't know me, I'm Dr. Andrea Schnowske. I am a chiropractor and holistic healthcare provider. And we did change our name beginning of the year. So if you knew us previously, we have changed our name as of January 1st. We are now Freedom Chiropractic and Holistic Health. We're still in the same location. We still have the same phone number. We do have a new website though. So check that out, freedompeoria.org. So let's go ahead and get into it tonight. So one of the things that I always like to kind of let people know and be aware of is that cholesterol medications are harmful if they're taken long-term. So I'm going to tell you a little bit more about some stories that I have seen or stories that I hear a lot of times when it comes to certain symptoms we get when we're taking cholesterol medication, or for people that do have adverse events and other health issues that pop up due to those medications, which are known as statins. So we're going to first talk about Duane Graveline. He is a medical doctor. He's also a former flight surgeon with the U.S. Air Force. He was also a NASA astronaut and also retired family doctor. So his story is a little interesting. He actually had a lot of neurological issues going on. He was put on Lipitor in 1999 from doctors at the Johnson Space Center. And after he started those medications, he began getting transient global amnesia, which means basically he did not really know who he was. He didn't know the day. He was not really understanding what it was. And he had that happen for about 6 hours after he began taking that. So 1 year later, he was taken off immediately. 1 year later, his doctors restarted him on half of that dosage, so 10 milligrams, 5 milligrams. And about 2 months later, after starting that medication again, he had another episode of that. So for 12 hours this time, he believed he was a 13-year-old high school student. He knew his class schedule. He knew his teachers and his classmates' name. He knew exactly what was going on when he was a 13-year-old boy. Mind you, he was an older gentleman at this point. So he had no memory of his entire adult life as a side effect of this medication. And we'll talk a little bit more about why that happens when we talk a little bit more about statin medications and some of their harms. In the past 2 years, or the 2 years after taking that medication, he began to have issues with muscle strength. He began to have weakness. He began to have some fatigue issues going on, and he began to lose coordination as well. So in 3 years after taking that medication, he had gone from living on the side of a mountain, cutting his own wood, being in peak physical condition as an astronaut, to become basically an old man suffering from ALS, which you might know as amyotrophic lateral sclerosis. Basically, it is a neurological disorder. So his brain and nerve systems were not working properly. He had permanent mitochondrial damage. So those are the centers in your cell that help with producing energy. So he began having weakness as a result of the nerve and energy issues that were happening as a side effect of this medication. So in that 3 years time period after taking that medication, even the small dosages that he was on, he had some very serious health issues coming from that. So just so you know, in that 3 year time period, he was on that medication for less than 5 months at a dosage of 5 to 10 milligrams. So a very small amount. I know I have some patients that are taking double, even triple that currently when it comes to some of those statin medications. Michelle is another gal. I want to share you her story as well. So 8 years previously, her doctor had put her on Lipitor. She began to notice some differences in her body. She began noticing itching. She said that her doctor had done some testing to find out what was going on, and her liver enzymes were elevated and her liver wasn't working properly. She was sent to a gastroenterologist who diagnosed her with primary biliary cirrhosis. So basically, she had a liver issue going on as a result of that medication. She was only on Lipitor for 8 days when that began to happen. And due to the damage that was done to her liver as a result of that medication, she is now taking 10 pills per day for the rest of her life because of the damage that was caused by that medication. So again, this isn't something we hear about every single day. These are rare occurrences, but those statin medications do change how your body works, and they can be harmful. We're going to talk a little bit more about what they do and some of the things that they affect in your body. Angela is another patient that I want to share her story. So she had some issues. Her husband was having some issues with his cholesterol levels, and he was told by his doctor he had to be on statins for the rest of his life. After taking those statin medications for a few weeks, he couldn't walk without a walker. He began having issues with erectile dysfunction and also other muscle balance and weakness issues. He began to have some personality changes. He was irritated. He was full of rage. His doctor told him that if he didn't stop taking that medication, he would have a heart attack. Now, the reality is there are many other ways that we can protect our cardiovascular health, which is what we're going to talk about tonight. But after taking and stopped taking that drug, he began to get reuse of his muscles in a few days. So there's a condition called rhabdomyolysis, which basically means that your liver and muscles stop functioning properly with those medications. It is a side effect. So he's 68 years old now, much healthier lifestyle, but he was able to basically look at natural options for getting those cholesterol levels under control. And that was, again, with diet and exercise, which is what we're going to talk about tonight. So the agenda for tonight is talking a little bit more about what cholesterol is, what it does in your body, because it actually is something you absolutely 100% need in your life. Your body needs cholesterol to make a lot of different things. We're going to talk a little bit more about cholesterol numbers and what they mean. If there's one specific number elevated, that can actually lead you as to what you need to help your body do to get that under control. We're going to talk a little bit more about statin medications and some of the treatment options that are out there in the traditional medical world with statins. And we'll talk a little bit more about the overuse of those statins as well as some of the side effects. And then we're going to talk about some natural options for getting cholesterol under control or lowering those numbers as well tonight. So when it comes to cholesterol, you have to realize that cholesterol is used by every single cell in your body. Now, that cholesterol actually helps coat every single nerve in your brain and every single nerve in your nervous system. In addition to that, cholesterol is actually going to help with vitamin D production. It's going to help with every single hormone in your body. So your sex hormones, your estrogen, your progesterone, testosterone are all made from cholesterol. Certain enzymes in our body also require cholesterol, and also the bile acids that help us digest fat need cholesterol. So if your cholesterol levels are out of range, that could be your body's way of telling you something's not working properly. If you're on a medication, specifically a statin, that's going to actually change cholesterol role, and your body's not going to be able to produce or utilize that properly. So that can cause a lot of other health issues when that cholesterol function or that pathway is not working properly. So when we look at a nerve cell, so this is a nerve cell in front of you, this picture here. So we've got on the very left side of the screen, the dendrite. Those are going to be basically the cell body. And then we have that sheath kind of in between, that little line there has coated in that yellow stuff. That is actually myelin sheath, which is rich in cholesterol. Every single nerve cell in your body, every single cell in your brain is covered in that myelin sheath. That keeps your nerves working properly. So if we start having issues where, we start noticing that we're getting weaker or things are kind of slow to react, slow to function, that may mean that your body is starting to lose that myelin sheath. And a lot of times we can see myelin sheath issues with a lot of other neurodegenerative issues. So any type of neurological problems like dementia, Alzheimer's, ALS, all those types of things typically have issues with that myelin sheath. Also, multiple sclerosis can also have some issues with this too. So very important to realize that everything in your body is controlled by nerves, and those nerves are coated in cholesterol. So if you don't have the proper cholesterol levels, or if your body's struggling to get that working properly, or that pathway working properly, we can see a lot of neurological issues come about from that. The other thing to think about is when it comes to those sex hormones, we talked about that already. So when you have cholesterol, yes, you need cholesterol to make all of your steroid hormones, which is going to be your progesterone level, your estrogen level, your testosterone level. It's also going to help with aldosterone for blood pressure regulation. It's going to be making DHEA, which helps with your immune system. And it's going to make cortisol to help with stress and also how your body reacts to fight or flight mode. If your body is not getting enough cholesterol, you're going to run out of resources, or Lego blocks, as I like to call them, to make those hormones. So it's very important to make sure that you are not only getting cholesterol, but absorbing it or making it properly. And if not, There may be a problem where you may have some hormone balance come about from that too. So when it comes to cholesterol numbers, there's a couple different numbers we need to keep in mind. So we have basically your HDL, or your high density lipoprotein, or good cholesterol is what people like to refer to that as. That is actually cholesterol. It's a kind of a carrier cell that actually takes extra cholesterol from your arteries and sends it to your liver so that your liver can get rid of it out of the body. So this cholesterol actually removes plaquing from your arteries and helps remove excess cholesterol from other areas of the body, sends it to the liver so the liver can get rid of it. We typically want to aim for, ideally you want to aim for about 50 to 60 range. Most lab testing wants you to get a minimum of 40 to be in normal range. But again, keep in mind, if you have high risk factors for heart disease, if you already have plaquing, we may want a higher number for you specifically. Another number when it comes to cholesterol is going to be your low density lipoprotein, or LDL, or the bad cholesterol. A lot of people like to call this one. This is actually not a bad cholesterol. In reality, this actually sends cholesterol from your liver out to your organs so that you can make hormones, you can repair nerves and any vascular damage. So what actually happens is this sticky cholesterol actually will kind of act as a patch over any damage to your vessel wall. So if you have any damage to the vessels inside of your cardiovascular system, that'll act as a patch kind of sealing that up so that we don't get any further damage or bleed out from it. So that does act as a protective mechanism. The problem is if we get lots of plaquing, that can definitely cause some issues where we're getting less blood flow. So LDL cholesterol, not exactly a bad cholesterol. It's just basically an enzyme, or kind of a transport system that will take that cholesterol out to the rest of the body to make stuff. So not a bad thing, just we need to make sure it's in proper range. And normal range for that one should be under 100 milligrams. Typically, if you are eating a diet that is very high in processed foods, if you're eating a very high fat diet, sometimes those numbers can be off. Also, I've seen those off with pregnancy and breastfeeding as well, because we need those to make extra hormones. So if you are pregnant or breastfeeding, those are higher than normal, not necessarily a bad thing. We just want to make sure that your body has what it needs to function properly. Another thing we need to keep in mind is our triglycerides. So triglycerides are basically fat that is carried in the bloodstream out to your tissue. So those are kind of the free fats floating around in your bloodstream. Again, not a bad thing. We do need those to move fat around the body, but typically when it comes down to that, we want to make sure that those levels are under 150. Now, if your triglyceride levels are very high, that may mean that your body is breaking down fat and kind of sticking it around the body. We have higher levels than normal. A lot of times that can be directly related to your diet. So if you're eating a lot of processed foods, if you're eating a lot of foods that turn into sugar very quickly, that may be why those numbers are high. So some dietary change can definitely get those back in normal range. When it comes to total cholesterol, so total cholesterol, a lot of people say, oh, my total cholesterol is high. But in reality, if you look at what's actually made up of that, your good and bad cholesterol, when you add those up with your triglycerides, that's going to give you that total cholesterol number. So ideally, we want to make sure that that level is under 200. If it's higher than that, we are going to have, number one, higher fat levels than normal within our bloodstream and higher cholesterol levels than normal. And that may mean that your body or your liver may be struggling. So if your total cholesterol is high, however, your HDL cholesterol is over that 40, or if you have a higher than normal HDL cholesterol, which is that cholesterol, or that carrier that basically takes that excess cholesterol back to the liver, that's not necessarily a bad thing. It just means your body is ready to get rid of any extra cholesterol around. So by itself, total cholesterol cannot be a bad number. Just tells us we need to look a little deeper as to see if there's something that needs a little extra help. And then when we look at our total cholesterol to HDL ratio, so again, that's the total ratio to our HDL, or good cholesterol, the lower the ratio we have, that means a lower risk of heart disease. So if we have higher than normal HDL levels, but our total cholesterol is in normal range or slightly high, not a bad thing, because if that ratio is pretty low, that's a good thing, because that means we have a lower risk of having heart disease issues. So when it comes to statistics, when we actually look at cholesterol numbers, about 71 million American adults have high HDL or high LDL, which is that sticky cholesterol levels. And when it comes down to it, these adults do have twice the risk of having heart disease, but we need to realize that only 1 out of 3 adults with high HDL cholesterol actually have it under control. So just having high LDL cholesterol is not a bad thing, but we are going to have higher risk factors. So we want to do as much as we can to get that back in normal range and get it under control. And that means that we need to make sure that we look at a couple different things. Number one, the balance between LDL and HDL cholesterol. We need to look at our triglycerides. We need to make sure that ratios are not very far off. So some treatment options that are out there. So typically when it comes to traditional medical treatments, we'll look at medications such as statin medications. We can also look at natural options such as diet and exercise. There's also some supplements that can be really helpful as well. So we're going to talk a little bit more about statins first. So statin medications, everybody wants to know, well, how do they work? What are the side effects? And what do you mean by overuse? What does that mean? So we're going to talk a little bit more about those. So when it comes to statin medications, they work by blocking the liver's natural production of cholesterol in the liver. So that means it tells your liver, stop making cholesterol. But I already told you, you need that cholesterol for a lot of different things. So in the short term, to get cholesterol levels under control and try to prevent heart disease may be a great thing. But if we're taking those long term and stopping the liver's ability to use cholesterol and make cholesterol, that may be a bad thing. So when it comes down to it, it's going to block the enzyme that is required for your body and specifically your liver to make cholesterol. That's, again, used in your nervous system. It's used in your hormones, your vitamin D, and a lot of other things. Statin medications also interfere with CoQ10 synthesis. So that is a specific nutrient that your body needs. It's used for energy production. It's also an antioxidant to prevent damage to your cells. So when we look at statin medications, I already mentioned that they do block and interfere with cholesterol production. That's going to actually reduce your body's synthesis or making of vitamin D in an active form. So cholesterol is a precursor to vitamin D creation. So without cholesterol, you're not going to be able to have high enough vitamin D levels. So if you're on a statin medication and your vitamin D level is low, this may be why, because that statin medication is starting to affect other body systems, and it may not be very safe for you to continue that. That's definitely something we need to talk to your doctor about and maybe see if we can look at natural options to get that under control. So when it comes to cholesterol, I've got a picture here kind of showing you. So this is kind of a pathway that our body uses to make cholesterol. So at the very bottom, you see in that green is cholesterol. So your body actually takes all of these little precursors, transforms them all the way down to cholesterol. Now, there are two different types of medications typically that are used: statin medications, which work on that very top number there, that top enzyme there, the HMG-CoA reductase. That's where statin medications block the production of cholesterol. If you're on a bisphosphonate, and those are also used for a lot of other conditions. I've seen them used for osteoporosis as well as other ones, but those bisphosphonates typically are going to block those other enzymes there that help with that cholesterol production. So if you're on any of these medications, especially if you've been taking them for over 2 to 3 years, we may need to look into getting off of those and looking for safer options, or see if we can actually manage those with diet and exercise. All right, so when it comes to specifically some of the numbers, especially when we're looking at those medications, Lipitor claims to reduce heart attack risk by 36% in patients with multiple risk factors, and they claim that they reduce the stroke risk by 48% in patients that have type 2 diabetes. And typically, if you actually look at the numbers, sometimes, when it comes to marketing, they're not always clear with what they're trying to say. But in a trial that looked at basically patients taking a placebo versus patient that take Lipitor, there was only actually a 1% difference from the placebo to the ones that were taking Lipitor. So they say 36%, but in actuality, it was only a 1% difference between those. In that second one, the claim with stroke risk, we had 2.8% taking a placebo versus 1.5% taking Lipitor had a stroke. So again, they're saying a 48%, but it's really only a 1% difference between those groups. So we have to look a little deeper sometimes with some of those marketing claims. So some of the side effects that we can see when it comes to these statin medications, I'm just going to go ahead, I'll read a couple of these. So I mentioned already that we can have some issues with neurological issues. So we can see issues with walking, we can see issues with nerve damage, we can see issues with muscle issues, we can also see liver damage, we can see heart issues, we can see arthritis, memory problems. There's a lot of different things that can be affected because, like I mentioned, those statin medications typically interfere with normal production and normal processes in your body. So we can see a lot of problems with those. Like I said, if you've been taking those for longer than 2 to 3 years, or if you've had side effects already or are having some of these side effects, it may be time to talk to your doctor about a different way to manage your cholesterol level. And we'll talk a little bit more about what we do in our office to help with that. So statin overuse, I mentioned this already. In 2010, we spent $37 billion on medications for statins. It's one of the 10 best-selling drugs in 2010. Lipitor was actually number 1. It led at 7.2 billion. Crestor brought in 3.8 at number 8. And one of the most prescribed drugs in 2010 was Zocor, which is a generic form of Lipitor and Crestor. We had 94.1 million prescriptions. So that means that basically anytime that patients were going to their doctors and they had high cholesterol levels, a lot of times their doctor would recommend taking a statin medication to try to get that under control. But in reality, what we've actually found is the American Medical Association, American Heart Association typically do recommend doing diet and exercise changes first to try to get that under control. The problem is, a lot of times your medical doctor may not have the time to sit down and talk about some of the dietary changes and exercise changes to basically manage to make sure that levels gets under control. So for a lot of people and for a lot of doctors, it may be easier to recommend a prescription because they may not have the resources available to help you with the diet and exercise changes. And that's where we come in. So when it comes down to it, when we look at statin medications, certain statin research actually shows that that should be adjusted based upon their need for lowering cholesterol levels. That means that everybody should have usually a smaller dose to start and increase until their cholesterol levels are under control. That's actually been as low as 2.5 milligrams per day has been shown to be effective for most people. But a lot of times what happens is your doctor will give you a 5 to 10 milligram prescription, and that may actually be a lot more than your body specifically needs. And that can actually increase your risk of liver injury by 4 times the normal amount. So just be aware that when you're taking a high dosage of statins, especially if you only need a small amount, that may cause or put you at risk for liver damage. We also want to keep in mind that Lipitor is now being prescribed for children. So the American Academy of Pediatrics recommending screening children as young as 2 years old for cholesterol imbalances. And it's actually been approved in children 10 to 17. So it's been allowed to be prescribed for children in that 10 to 17 group since 2011. I talked a little bit more earlier about CoQ10. So CoQ10, again, is that energy production nutrient that your body makes. And when you have a low dose of statin medications, it's actually been linked with a major loss of that vital cardiac nutrient. So when you take 80 milligrams for 30 days, your CoQ10 actually dropped by 50%, according to a Columbia University study. If you took 10 milligrams for 8 weeks, it dropped by 40%. So even taking a smaller dosage for just a few months can actually drop that CoQ10 level very low. So if you're on a statin medication, you may need to take a CoQ10 supplement to help make sure we get that up. And if you've been on it for a while, we may want to look into possibly getting off that statin and talking to your doctor about some other options that might be safer for you, especially long-term. Now, I talked a little bit more about neuropathy or nerve damage caused by Lipitor. Typically, that can occur after about 2 years of use, but for some people, they can have damage starting or symptoms starting within 48 hours after starting that medication. And 1 in 10 statin users will typically experience some form of neuropathy or nerve issues. So when it comes to that CoQ10, we have to understand that that is an essential nutrient that even though we have those popular medications of statins, they can actually be kind of dangerous. So we want to make sure we understand that those do deplete that CoQ10. We want to make sure we keep that level back in normal range, and we want to make sure we support our cardiovascular system, our energy systems, our nervous systems as much as possible. So when it comes to statin medications, you have to ask yourself the question, especially if you're planning on taking this long term. Do you want to risk your health by taking that for a long period of time? So we're going to talk a little bit more about some natural options and things that you can do at home, as well as with the help of a holistic healthcare provider like myself to manage that or get it back in normal range. And we are very willing to work with your medical doctor and even call their nurse or the doctor themselves and talk with them about ways that we can work together to get that level under control and have them still monitoring and making sure it stays in the normal range for you. So number one, we want to make sure we're looking at dietary changes as well as exercise to help make sure that number one, we are keeping your body getting the right nutrition, but also making sure that your body is able to exercise to get rid of and work off of that excess cholesterol. There are some supplements that can be really helpful. So we'll start with diet. So number one, diet, we want to make sure we're eating more frequent meals throughout the day. So grazing, as I like to call it, you want to make sure you're eating about every 3 to 4 hours. I typically recommend that you're doing some type of protein as well as a fruit or vegetable for those snacks throughout the day to keep your blood sugar more stable. We also want to make sure that we're avoiding foods that have trans fats in those. Trans fats actually tend to kind of clog up your liver and also have been associated with other risk factors as well, but those are something you want to avoid. Partially hydrogenated oils are the names that you'd want to look for on the label. You also want to make sure that you lower your intake of sugar and fructose, so that's going to be any types of added sugars and also fruit sugars. You want to cut back, not cut out completely, but cut back on and watch your intake of sugar so that it's not very high. We also want to make sure we're limiting the amount of saturated fats that we're eating. Saturated fats typically are a little bit harder to digest, but also can tend to make a little bit harder wear and tear on your liver, especially if it's already taxed with trying to get cholesterol levels under control. So saturated fats are found in dairy products, red meats, and tropical oils, so coconut oil and things like that. So just be careful that you're limiting the amount of those things that you're taking in. We also want to make sure we're limiting our dietary cholesterol intake to 100 milligrams a day or less. So make sure you're looking at what you're taking in, because if you're eating a lot of cholesterol-rich foods and you're not, or your liver is struggling to get rid of those due to an imbalance of those cholesterol levels, it may be hard for your body to get that under control if you keep adding to the problem. So when it comes to dietary changes, typically there's also some things you can do with kind of aiming for different foods that can also help. We can aim for more omega-3s, which are found in more of your cold water and wild caught fish. Typical recommendation is 2 to 3 times a week. We also want to make sure we're getting increased fiber from fruits and vegetables. That'll help to bind to excess cholesterol that is out in the body and flushed out through the stool. Things that would consist of fiber intake are legumes, as well as fruits, root vegetables, oats, barley, and flax are also helpful for that. When it comes to exercise, we want to make sure that we are doing cardiovascular exercise, getting that blood pumping, so we're getting everything cycling through our liver and getting that liver working properly. You want to make sure you're walking 2 to 3 miles at least 5 days a week. So if you need to split that out a little bit more, that may be helpful for you. We also want to make sure we're doing 30 minutes of moderate intensity exercise. Moderate intensity exercise has actually been shown to lower LDL, or bad cholesterol levels, if we're doing that regularly. So I recommend about 30 minutes, 5 days a week, and that's moderate intensity, so just enough to raise your heart rate, give you a little bit of gasping breath, but not out of breath. So that may be something simple like doing a class or doing a workout with some weights or resistance bands. You can also do things like aqua Zumba or things like that, just something that's going to increase our heart rate for you. Supplement-wise, it comes down to it. We have a product in our office that we carry called Cholesterol Pro. This actually has been shown to lower your LDL, or your bad cholesterol, and your triglycerides to try to get those under control. It does help to raise your HDL, or good cholesterol, with no side effects. Another supplement that can be helpful is omega-3. I mentioned those already. Omega-3s actually protect your body and your vessels against vascular damage. They can improve your cholesterol and your triglyceride levels if those are not in the proper range. Another thing that can really helpful, especially if you're having trouble getting enough fruits and vegetables, is absolute greens. 1 scoop of absolute greens gives you basically your full serving of fruits and vegetables for the day. It also has some added probiotics in there to help with digestion. And that's going to help remove excess cholesterol through your intestines. It's going to prevent oxidation of cholesterol so it doesn't harden and start to cause plaquing in the arteries. And then CoQ10, I mentioned this one as well. CoQ10 is really helpful. That's going to help to replace any damages if those levels were damaged from taking a statin medication. So that's another thing you may want to look into adding in. So recap from tonight, in case you've been taking notes and maybe missed something. I know I talk kind of fast. You want to make sure that you understand that cholesterol is essential in your body's daily functions. You can achieve healthier cholesterols with diet and exercise. Medications can reduce cholesterol, but in the long term may not be the best option because they do have some side effects. Supplements can give your body the extra support that you need to lower those cholesterol numbers faster. But if you need more personalized help, or you feel like you're kind of lost in limbo land, or you want somebody to talk with your doctor, you can set up a consultation in our office. We sit down with you one-on-one. We'll go over your dietary as well as any lab work that you've had done. I'll be able to give you some personalized recommendations for you specifically. We can talk a little bit more about diet suggestions and just see if maybe we can change how you're eating or what you're eating to swap out for some better options. We can talk a little bit more about some of the medications and side effects of the medications that you're taking. We can talk about some supplements that can help for you as well. And I also have a free cholesterol research handout that I can give you as well, talking a little bit more about that diet and exercise and supplement aspect of getting that cholesterol level under control. And any supplements that I would recommend during that consultation are 10% off. You can either give our office a call, 309-689-6200. Again, we are Freedom Chiropractic and Holistic Health. We're located in the Metro Center in Peoria, Illinois. You can also go on our website to request an appointment, freedompeoria.org. You click on that new patient tab. You can put your information in there and send an appointment request, and we will get that set up for you. We also are in network with a lot of insurances. So for those consultations or office visits, we would be able to bill out to your insurance. If you have any further questions, feel free to give me a call, or like I said, go on our website and we can get that consultation set up for you. So thank you so much for attending tonight. Hopefully you learned something. I know a lot of times when it comes to, just overall health, we need somebody to kind of give us some suggestions and guidance as to where we are and where to go from here. So again, thank you so much for tuning in tonight. Hopefully you learned something. And I really hope that you've been able to really glean a lot of information from this and see about how we can help you with that. So have a great night. Thanks for tuning in. And if you haven't yet, make sure you subscribe to our YouTube channel and hit the bell icon so that you can be alerted for new videos.